Hi, Ruby. Thank you so much for giving me all that information. So, to continue with this intake, I just want to ask some questions just to get a little bit more information as to where this progress has to go regarding your treatment and some of the desired outcomes you might have. So, my first question is, what does your baseline of anxiety look like? Okay. Um, Do you have any triggering events that you can align with your most recent uptick in symptoms? Okay. Um, and what did that look like when those events happened? And if I remember correctly, you said that your mother became worried about you and your friends noticed some increased irritability after those events. Okay. When your mother calls daily, what specific worries does she mention? Okay. Yeah. And do you agree with her? I see. Yeah, sometimes moms can do that. Most moms do worry a lot. My mother often says, when you're a mother, you're contracted for life. Um, you mentioned you have a thyroid condition. What condition is it? Is it like hypothyroidism, Hashimoto's thyroiditis, which can lead to um, a decreased thyroid productivity? What does that look like? Gotcha. And what medication are you on for it? Levothyroxine? I see. When was your most recent blood work drawn? Oh, so it's coming up? Great. I'm asking because, well, I mean, you have the condition of hyperthyroidism, and I know that uh, if, I mean, in combination with some of the triggers you mentioned earlier, if there's an uptick in your thyroid levels, there could also be, therefore, increased metabolism. There could also be symptoms of anxiety as well. So I'm glad you're following up with your doctor about that. Um, okay. Noticing a little bit of dry skin and hair loss. So that can cause some anxiety as well. You told me that you missed much of your senior year in high school due to anxiety, and you're in your last year of college now. Do you find any parallel thoughts, feelings regarding graduation? And what coping skills helped you at that time? That's when you fell in love with the gym? That's great. Yeah, and it's a great coping skill to have. Yeah, exercise is a wonderful thing, as long as it's not overdone. Everything in moderation. Um, yeah, yeah. What medical interventions were required back then when you graduated from high school, I mean? Okay. And do you think they would be applicable now? Interesting. Yeah, thank you for that. You shared that you recently broke up with your boyfriend of 4 years because it ran its course and that the distance was a bit taxing. Um, Tell me more about that. A lot can happen in 4 years. And definitely the college experience, you know, people grow up a lot, usually, um, and people can grow apart in that time. What attracted us to partners when we were in our teen years, going into adulthood, a lot of our personality traits can change. Some may solidify, some may totally transform into something else. And the person you were 4 years ago may be very different from who you are now. And same with your ex boyfriend. Yeah. I'm curious as to how you both are dealing with the breakup. Okay. Could you tell me a little bit more about this panicky feeling you experience when you consider going out with your friends? And has it negatively impacted your relationships with your friends? And did you also feel this panic before you decided to break up with your ex-boyfriend? Okay. Well, I appreciate you telling me all this information. I think it will definitely help guide the course of treatment, and we can follow up in our next session. Thank you. See you then. Bye.